Although severe abdominal pain brought me to the hospital, that was not while I was admitted. A high von Willebrand factor led to aortic thrombosis. Learn more about von Willebrand factor and aortic thrombosis. Hi, as I promised, I would go more into my rare condition. Before I go into talking about the thrombosis on my aorta, I wanted to talk to you about something called the von Willebrand factor. I'm hoping I'm pronouncing it right. The von Willebrand factor is a glycoprotein crucial to primary hemostasis through platelet and subdolenical collagen adhesion and intrinsic collagen cascade through factor VIII stabilization. Let's go into English. The von Willebrand factor is named after a Finnish physician, Erik von Willebrand. Erik von Willebrand had discovered a inherited bleeding disorder back in 1924. Therefore, they named this bleeding disorder, or the von Willebrand disease, after him. Now, the von Willebrand factor, if you look up von Willebrand disease, you might say, hey Penny, this doesn't match what you say, because I'm having problems with blood clotting. And if you was to look up von Willebrand disease, you would find out that the von Willebrand factor, if you have too little of it, you have a problem with your blood not being able to clot. In other words, if you was to cut yourself, you would bleed and bleed and bleed. It means the von Willebrand factor is that agent, or whatever you want to call it, that when you cut yourself, you notice that after a while it starts to clot in order to keep you from bleeding to death, and then you stop bleeding. Too little von Willebrand factor will cause you to bleed and bleed and bleed. And if you look up the von Willebrand disease, you see that there's 3 different types of this disease. Now, I can go a little bit more into the 3 different types of this disease, but I wanted to explain to you about the von Willebrand factor and what it has to do related to me, because I have a problem with blood clotting. Well, here's the thing. My particular von Willebrand factor problem is that it's too high. My von Willebrand factor usually goes on a scale of about 50 to 200. My von Willebrand factor is 473. This means that I have just the opposite problem, and that my body just keeps on creating blood clots for whatever reason. So I wanted to go into the von Willebrand factor to explain to you that my body, because my von Willebrand factor is way high at 473, when the highest level you should be is about 200, or maybe 250 or something like that. I have a blood clotting disorder. Okay? Now that we've got that explained, we're going to go into the blood clotting disorder that I have. My story. Now, I have said in earlier videos that at this time I may or may not have put on there, but hopefully put on there before you get this one, that I have an aortic thrombosis. Okay? When I went into the hospital, because I've been having a lot of problems with abdominal pain, and I would go into the bathroom and I would end up in extreme pain and excruciating pain. I mean, it made my fibromyalgic pain look kindergarten, to where at that very moment, if the only way to get rid of the pain was death, even though I don't want to die, I would be like, it's better than this. That's how bad it is. This started 10 years ago. It lasted all night long the first time I had this problem, and my late husband was working nights at the time. And when I looked up information, I thought maybe I passed a kidney stone, and didn't have it again until after my late husband died in 2013. I had it probably in 2014, maybe the end of 2013. It didn't last as long, but it was still very painful. Didn't have it again for another 6 months, and then didn't have it again for another several years. And so I figured this was just something I was going to have to suffer every so often. It was extremely painful. Well, I had it again on January 16th, and then again on January 30th, and that concerned me. And at that time, I went into the hospital, and they said I had gastroenteritis and esophagitis, which basically my whole intestinal system was inflamed. They put me on medication that apparently didn't work because I had it again. When I had it before and went to the hospital, I kind of waited until after the worst of it was over because you could barely get me out of the bathroom between the vomiting and the heaving and the diarrhea. And I was like, got hot and then sweat, and I was soaking wet, and then I was cold and clammy and white, pale white. Anyway, I waited until after the fact. Well, when it happened again, I had Bill take me to the hospital during the time it was happening, and it took 3 bouts of morphine to get me to be able to stop screaming in pain. Now, I was like, you're already giving me morphine, but they could tell it didn't work. It wasn't until I got hit with the 3rd shot that I was like, anyways, that's when they asked if I had an accident, because they said I had a spleen infarction, and then discovered that I had an aortic thrombosis. The aortic thrombosis, also known as pleural thrombosis, is a rare condition located on the main artery that carries the blood away from the heart, and it could be life-threatening if it blocks the blood flow to the organs and the extremities. And because of this, it is considered a medical emergency, and it needs prompt attention. Doctors usually either surgically remove it or give medication. I'm not sure I'm going to be saying this name right, so please don't hold it against me, but risk factors known as Virchow triad, named after Dr. Rudolf Virchow, are associated with increased risk of developing thrombosis, including the aortic thrombosis. And these risk factors are blood vessel wall injury from catheterization and other causes, hypercoagulability, meaning that the blood is too thick, it sticks together too easily, changes in blood flow caused by activities such as extended periods of immobility, in other words, not moving around that much. Many causes are linked to heart catheters. Heart catheters are used to help diagnose and treat heart conditions. Heart catheters are a hollow tube that either goes through the artery or the vein. It is inserted through the groin, the neck, or the arm. It goes through the blood vessel until it reaches the heart. I had one inserted in my arm back in 2014. Anyways, the catheter can cause the wall of the aorta to become inflamed, and it can increase the chances of blood clotting creating in your aorta. A sudden inflammation of blood vessels can also potentially put you at risk for developing aorta thrombosis, and it can be caused by crack cocaine use, which I don't use drugs. Heparin-induced thrombocytopenia, another word that I cannot pronounce. The thing is that they were using heparin on me, but this was to break up the thrombosis. But it is a complication of medication, heparin. Pancreas, but I was told that my pancreas was okay. Aortic thrombosis that develops with an unclear origin is called spontaneous aortic thrombosis, and those are extremely rare. In 2020, aortic thrombosis has been reported as a rare complication due to COVID-19. There were 4 people who were admitted into the hospital due to respiratory issues because of COVID-19 that later discovered had an aortic thrombosis. One of them actually died. COVID-19 may have predisposed people to an aortic thrombosis for the various reasons. One could be increased inflammation. Another can be immobilization due to extended bed rest, also narrowing of the blood vessels, and blood hypercognitibility. I really can't say that very well, but that's the best I can do. Aortic thrombosis is also associated with chemotherapy and estrogen therapy and can be elevated by people with cancer who are receiving chemotherapy and estrogen therapy. In older cases, researchers have discovered that people have developed an aortic thrombosis while on a course of cisplatin-based chemo, another word I can't pronounce. Symptoms of an aortic thrombosis can be mistaken for a stroke or other neurological conditions. The signs and symptoms can be mild or fatal. I'm going to read this because it's too much for me to remember, and as it is, if you had just known all the bloopers on this. So anyways, these symptoms include a decreased pulse, unexplained abdominal pain, in which I do have, high blood pressure, in which I do have, congestive heart failure, like loss of blood flow in the limbs that can cause coldness and the lower legs and feet, numbness and weakness, and painful cramping. Cespis, metabolic acidosis, which occurs when the fluids in your body become acidic, and organ failure. Because it is a rare condition, a blood condition, the medical community is controversial on how to treat it, but the best ways they had found so far is through medications that would help break up the blood clots in the different organs, and they also, in some cases, will do surgery if the medications aren't working. In 2022, the studies and the researchers have found that 50% were treated with medications and 34% were managed with minimally invasive, I'm going to try to pronounce this, endovascular procedures. 16% were managed with traditional surgery. Surgery is actually a last resort. Medications alone may successfully dissolve the blood clots, and these medications are like heparin, warfarin, and noxaparin sodium. I cannot pronounce these, but it also includes aspirin and dalparanin. I'll try to find the list to put up there. In my case, though, they've got me on Xarelto, which is a Riverobus. I cannot pronounce these. Seriously, I am not an expert at pronouncing these things. Sometimes blood clots can be surgically removed if the blood clot has a mass greater than 1 centimeter across. You have a history of blood clots. The clot develops in certain parts of the aorta, or it's not possible to distinguish between the blood clot from the mass on the imaging test. Complications can develop from an aortic thrombosis. Some may be mild, and some may be more severe or even life-threatening. Because it is rare, there is no real information on the survival rate, but it is believed that up to 75% of people with aortic thrombosis, it is fatal. It can block the blood flow through the aorta, and it can restrict and prevent blood flowing to any organ system. And if treatment isn't initiated fast, it can cause severe complications that include kidney failure, stroke, gangrene, and death. My grandfather had gangrene. I don't know what caused it, but he had to have his leg removed. And the one thing when I was in the hospital they were talking about is if this isn't fixed, I could end up having a part of my body removed, or they could even end up removing part of my intestinal system. Do you remember that case I told you about back in 2020 when there were 4 people with COVID-19 that had been diagnosed with an aortic thrombosis? Well, 2 of those people developed a stroke. 1 of those people developed pulmonary embolism. Two of those people developed limb eczeemia, that's a loss of blood in limbs. One of those people developed an acute mesmeric eczeemia, a loss of blood in the intestines. I can't pronounce all these words, but basically a loss of blood in the intestines. And one of them developed deep vein thrombosis. Bottom line, the aortic thrombosis is a blood clot that blocks and restricts blood flow to the aorta. The aorta is the main artery that moves the blood away from the heart to the rest of the body. The condition is very rare. It can quickly lead to life-threatening complications, and researchers are still investigating the best way to treat the aortic thrombosis. Doctors can either remove the blood clot through surgery or administer medications to break up the clot. In my particular case, they administered medications to break up the clot. Good news is I had that CT scan, and then I went to see my doctor, and fortunately the blood thinners that I am currently on have broken up most of the blood clots, or have dissolved most of the blood clots that were in other parts of my body on different organs and stuff like that. And the aorta thrombosis is still there, but it has dissolved most of it, so the blood thinners are working. One last update would be, I had limited time as far as my insurance because my boyfriend was retiring, and the doctors have done everything they could to try to get in an operation for me to have a stethoscope or something that was to go down my throat and check out my innards as far as the problems I'm having with my abdominal pain, which brought me to the hospital to begin with. But unfortunately, due to staff error, that was unable to happen, and my boyfriend has retired. We're happy about that, starting a new life together. But the problem that I started with is still there, and occasionally I still do have these problems with my abdominal pain. If you like what you see, be sure to hit that like button and subscribe to my channel and hit that little bell thingy. Have a lovely day.